Yo, YouTube. It's your boy John Paul Kelly.
And Tim Looney, back at it again. Thanks for the reactions on the last video. Make sure to hit that like button, hit that subscribe button, follow the boys. We're bringing all the science knowledge you need. Okay, so first off, we're just going to talk a little bit about what epilepsy itself is. Epilepsy is a neurological disorder marked by sudden recurrent episodes of sensory disturbance, loss of consciousness, and convulsions. When these three certain symptoms are associated with abnormal electrical activity in the brain, it often leads to seizures. These three certain symptoms involved with the abnormal electrical activity in the brain are not that common to see due to the fact that epilepsy is one of the most common disorders of the nervous system due to its effect on people of all ages, races, and ethnic backgrounds. Approximately 2.2 million Americans are living with epilepsy today. Epilepsy is caused due to many different factors. Certain factors include strokes, brain tumors, brain conditions, head trauma, infectious diseases, and the fact that epilepsy may have a genetic form, which is linked to the autism spectrum disorder, also linking to seizures in 1/3 of children.
Second off, I'm going to talk about the symptoms and treatments of epilepsy. Symptoms are temporary confusion, a staring spell, uncontrollable jerking movements of the arms or legs, loss of consciousness or awareness, psychic symptoms such as fear, anxiety, or deja vu.
And these certain symptoms aren't really able to be noticed. It's not like when you think you're gonna get sick, you can tell you're getting sick. Like, say for instance, like you're getting sick, you think you might throw up, you can feel that. These certain symptoms with epilepsy aren't noticed like that. You can't say like, oh, I think I'm gonna have a seizure in a few minutes. You could be sitting there in class and all of a sudden you start having an epileptic seizure.
For treatment, you could take a certain medication, go on a special diet, have an implant that works on your nerves, or possible surgery.
Oh hey, didn't see you there. Welcome to slide 4. Slide 4 is all about seizures. You may ask, what is a seizure? I'll tell you. A seizure is a sudden surge of electrical activity in the brain that usually affects how a person appears or acts for a short time. Although there are many different types of seizures, the epileptic seizure is also known as a tonic-clonic seizure. What does this certain type of seizure look like? It looks like a sudden loss of consciousness, sometimes with vocalization or calling out. The eyes, head, and body may turn in one direction. Kind of looks like an exorcism. The body becomes stiff, also known as tonic, followed by the jerking of muscles, clonic. If you see these certain symptoms, call 911 and get help.
Slide number 5. What to do if someone is having an epileptic seizure. First off, you should call 911. You should keep other people out of the way so that the person helping them can do their job. Clear hard or sharp objects away from the person. Don't try to hold the person down or stop the movements. Place the person on their side to help keep the airway clean. Time the seizure from start to finish because this is crucial for medics to know how long the seizure lasted. Lastly, do not put anything in the person's mouth. The patient may need surgery. No food or drink shall be consumed.
Congratulations on making it to the last slide, the conclusion, how to prevent an epileptic seizure. There's a lot of different ways to prevent a seizure. One is by wearing a helmet. You need to keep your brain safe at all times. You need to get plenty of sleep each night. Set a regular sleep schedule and stick to it. Too little sleep or too much sleep can mess with your brain and cause abnormal electrical activity. Learn stress management and relaxation techniques. Avoid drugs and alcohol. Take all of your medications as prescribed by your doctor. Again, too much or too little can cause too much electrical activity in the brain. Avoid bright, flashing lights and other visual stimuli. Skip TV and computer time whenever possible. Avoid playing video games. Yes, that means Fortnite. Fortnite is a video game. Avoid playing too much. Eat a healthy diet. Eating a healthy diet is key to keeping yourself healthy and your brain functioning properly. So here it is. The big question I felt you've all been waiting for is there any cure for epilepsy? As of right now, unfortunately, there is no cure for epilepsy. The only thing you can really do at the moment is just see your doctor when you can and receive medication for epilepsy. Currently at the moment, there's over 20 medications to help with epilepsy. Such medications include phenytoin, Dilantin or Fentech, phenobarbital, primidone, which is misoline, and valproic acid, which is depakine. And the sad thing about this is it's been such a long epidemic that's been going on that affects so many people, and you wish there could just be a cure for it. They can find a cure, but fortunately, right now there isn't. So hopefully, in the time coming, they can find a cure for epilepsy. So continuing on from the previous slide, I'm sure you were also wondering if doctors were taking any steps to find a cure, and luckily, yes. The answer is yes. Doctors are diligently looking into a cure for epilepsy. A doctor at the University of Utah Health has developed 3 new treatments that are edging closer to a cure for epilepsy. The 3 treatments are, excuse me for my pronunciation, stereoelectroencephalography, also known as SEEGE, which is when thin electrodes are placed in the head to gather intel on the brain's activity to pinpoint the origin of seizures. The second treatment is laser ablation, which is a safer, less invasive option to larger brain surgery where thin wire lasers target the tissue where seizures originate. And the third treatment is neurostimulation, which is when electrodes attracted to a computer processor are implemented into the brain to monitor seizure activity and deliver electrical pulses that eliminate or reduce seizures. And the only problem with these 3 treatments is that there's so many different types of seizures, and they all occur in different parts of the brain. So what they might find for one patient might be completely different to another patient in how their seizures develop. So when they may find a cure for, say, 1 to 10 people, there's also 2.2 million Americans, just Americans in general, who have seizure problems and have epilepsy. And epilepsy is completely different to any other normal person who has seizures. So this is like a huge problem. Like, yeah, you can maybe eliminate a few at a time, but there's no general cure for all these people who are suffering with these seizures. Okay, so here's just a screenshot of a YouTube video that was posted by the Colorado Children's Hospital on what to do if someone's having a seizure. And I know I already laid out those steps on an earlier slide, but this video just shows on the hands-on advice in exactly what to do in the scenario, just in case you do happen to be with someone and they have a seizure, what exactly to do in case the slides didn't lay it out for you. Yet again, here's another screenshot of a video from YouTube of a girl in her room having an absent seizure. She has it 4 times, just a few minutes, and they aren't real big seizures where you can tell, but it's the type of seizure like can be said and done in an epileptic seizure when the person just goes into a blank stare, gets confused for a second. They weren't on the ground shaking, they weren't biting their tongue, they were not out of consciousness. This was just an absent seizure of this young girl in her bedroom by herself. So this is something to notice just in case you do end up being in a situation where someone you with is having a seizure. It might not be very known that the person's having a seizure. Just like this young girl, she was just in a blank stare, so that can alert someone that this person is having a seizure. Okay, so listed here is our citations page. We use 7 websites in total in our presentation. The first website we used was from the Epilepsy Foundation in 2014 on the search of what is epilepsy. The second website we used was on the Epilepsy Society from 2018 on epileptic seizures. The third website we used, also with the fourth, was WebMD for what are the treatments for epilepsy and first aid for epilepsy seizures. Another website we used was My Child Without Limits, who does epilepsy affect. Another website we used was from Everyday Health, the Stroke Center on preventing epilepsy seizures. And the last one we used, which was located on one of the previous slides laid up, was from the University of Utah Health, which was New Tech Treatments for Epilepsy Edge to Closer a Cure. And we used a bunch of different websites for this project, and we wanted to use like the best information we could find that we could help present the project to the class. And we needed to find like what information was right, which information was wrong. We used multiple different websites to like make sure this information added up. So we picked the best websites we could find, best information we can gather, and that's the project for you there. We hope you'll enjoy. You learned something new today, in that in a time of need, if someone's having an epileptic seizure, or any type of seizure in general, you can be able to hop in, save the day. Thank you.